Hi, my name is Ben Westphalen. I'm ESMO's Precision Oncology Task Force Chair, and with me I have Sewanti Limaye, a member of our task force.
I'm Sewanti Limaye. I'm the Director of Medical and Precision Oncology and Oncology Research at Sir H.N. Reliance Foundation Hospital in Mumbai, India. Precision oncology has been central to my work, my body of work, and I founded the first Precision Oncology Center in India. And I'm really honored to be a part of the Precision Oncology Task Force and to be working with you, Ben. So the challenges with accessibility and affordability of precision oncology globally are vast. It begins with lack of investment. I think investment is most critical whether it comes from the government or public payer partnership or policies or insurance coverage, reimbursements. All of that becomes central to being reimbursed or being facilitated for the diagnostic tests that are needed for precision oncology implementation. Then, of course, there is lack of awareness, not just amongst the masses, but also amongst the providers. Just to know and understand that precision will change the outcome in a patient. In the oncology community, I feel there is a lack of that realization. And of course, there's a lack in understanding amongst the people. So it's the lack of awareness, it's the lack of implementation, it's also lack of availability of diagnostic tests and the funding for it. So a lot of gaps to be filled.
There's a vast array of barriers in the implementation of precision oncology worldwide. It starts with infrastructure of testing, offering the best and high quality testing to clinicians so that they find the patients that might benefit from a given therapeutic intervention. There is a lack of awareness, guideline adherence, offering standard of care, biomarker-driven standard of care to our patients. And then last but not least, a problem is access to therapeutics. The best testing modalities are completely useless if you're not able to act therapeutically upon identifying a biomarker-positive patient.
So the programs and initiatives that may help implementation of precision oncology globally has to begin at a government level, at a national level, where the bare minimum testing should be mandated for all cancer patients. Reimbursements through insurance companies should also include precision-directed diagnostic testing. I think it is imperative today to test appropriately so that there is no waste. You treat as per the guidelines and as the precision diagnostics dictate. The second thing that I feel is very, very critical is molecular tumor boards to help understand the data that spews out of the tests that we do. I ran a molecular tumor board at a national level in our setting, and I think that should be integral to how we strategize implementation of precision-directed treatment. Lastly, I also feel very strongly that clinical trials should come in to help access to novel cancer therapeutics in global areas, low middle income countries, and a lot of the application to precision directed treatment is limited because we don't have access to clinical trials.
In order to sustainably implement precision oncology and the technologies attached, we need common frameworks. And this is exactly what we do with the Precision Oncology Task Force here at ESMO. We build scales, we put out recommendations that are there to inform the global oncology community on how to implement novel technologies, how to evaluate them. And the aim is really to create an ecosystem of recommendations that allows you from a very local to a regional to a global level to implement precision oncology on a sustainable scale.
tailoring to local needs from a global level for best implementation of precision oncology, I feel there have to be certain exemplary bodies, and here I take guidance from the Precision Oncology Task Force from ESMO. And I feel it is a body that could be a guiding light to put up a reference standard as to how to practice and implement precision oncology. The next comes in locally. I think building the local framework is most critical. And there I feel a hub and spoke model as we practice or envision to practice in India also becomes very critical, wherein at my institution, we envision to be the hub and then empower 100, 200 off-site centers to not just discuss the diagnostics, but also to huddle up and discuss the therapeutic application to precision oncology diagnostics. And I think that becomes most critical because it's not just at a global level, but then even locally you're empowering the budding and the rising oncology population to learn the conduct of precision oncology and to deliver cancer care at a different level.
Sustainable scaling of precision oncology is a major undertaking. Capacities such as testing facilities, access to trained physicians are imperative in order to deliver the precision oncology promise to our patients. I believe explaining why it is important for a given healthcare system to implement therapeutics to be innovative is really important. We're hearing about international competitiveness, but competitive does not mean to compete with someone, but to be the best version of yourself. So investing into innovative infrastructures is really important. We have to step out of the dark. Precision oncology is not just a niche that you bring in at the end of a patient journey. In many cancers, non-small cell lung cancer, biliary tract cancer, breast cancer, to just name a few, precision therapeutics have really changed the trajectory of far advanced cancers. And to bring this into fruition, to demonstrate how well these therapeutics work, will be one of the barriers to overcome and demonstrate lasting benefit to the society.